We have our program today. It's Dr. Roozbeh Sharif, MD, MED, and MSc. Dr. Roozbeh is in critical care intensivist specialist in Houston, Texas. He attended and graduated from medical school in 2004. He has over 16 years experience, diverse experience in critical care, intensivist, and is affiliated with many hospitals, including the Methodist Hospital. Dr. Roozbeh Sharif is a pulmonologist in Houston, Texas. He's affiliated with multiple hospitals in the area. He's been in practice between 11 and 20 years. Pulmonologists treat ailments of the lungs, respiratory system, such as asthma, pneumonia, tuberculosis, complicated chest infections, and chronic obstruction of pulmonary diseases, including emphysema. He worked at the HCA Healthcare as intensivist, went to work for them as medical director of HCA Houston Healthcare Southeast Intensive Group. He was a staff physician intensivist at Houston Methodist. He's a fellowship in pulmonary and critical care medicine at the University of Alabama in Birmingham. He's a fellow at Duke University Health System and internal medicine residence at the University of Texas at Galveston. And basically, he holds a license in pulmonary medicine, internal medicine, and he also is a good friend of mine. We met about almost a year ago, and he's he's wanting to really make a difference in our community, and he's opening up a Bay Area personal wellness center in Webster. He is getting involved with our school district to help our kids. And so I'm going to introduce you to Roozbeh. Roozbeh, can you please let us know what's going on in our area?
Michael, thank you very much for that kind introduction. I feel honored to be here and talking. First of all, thanks for everyone for all the great work that you guys are doing in the area and beyond the borders. It is very meaningful, and it's basically who we are and what we are standing for. I always look at myself as someone who can, if I can push one very small step moving forward in humanity and alleviate someone's pain, that makes my heart happy. Most of my work currently are with everything that is going on. Can you guys hear me well? Is perfect. Is focused on the intensive care units. So sometimes I even joke when people ask me what kind of doctor you are, I say that the one that people are happy when they don't see me. So I'm glad that today we are talking about crisis, and I'm not seeing any of you guys in the hospital. COVID-19 definitely created something in our community and in our country, unprecedented amount of use of resources. And I think a lot of fear, especially some of it was kind of augmented with the misinformation that we are seeing in the community around us. But I wanted to give you guys a very quick synopsis of what it is and why this is so dangerous. Essentially, coronavirus has always been there, has always been causing symptoms such as symptoms of common cold. A lot of times that we get a common cold, that's because of the different type of coronavirus that we get. However, over the last few months, there was a first epidemic and then now pandemic part of it. And pandemic is those kind of things that essentially infectious disease, which are very contagious and essentially happen throughout the world. I think one of the last ones that we had was a Spanish flu. And this new one that has started in Wuhan, China, the specific virus is something that basically is between human and the animals. It's found in bat and rats. There are a lot of wet markets in Wuhan, China. I have seen, I'm sure you guys have also seen those, sometimes even disturbing videos about eating bat or rat alive. The thought is essentially that is the way that it has been introduced to human. There is not much proof for it with the lack of information and limited access that we have to the basically what is going on in China. The first time this virus was reported in 2005 in Nature, which is one of the most prestigious and oldest medical journal. And there was a huge warning at the time that essentially this virus, if it can get transmitted to the human being, it's going to cause a disaster. The way it works in almost 85% of people, 85% of people that get infected with virus, they may have anything from no symptoms to something between having symptoms of common cold, not even having a shortness of breath or hypoxemia, drop in our oxygen in our blood. And after that, the body builds immunity. I'm going to share something here in the chat box, which is essentially a graph showing sort of the disease course and how it works when it comes in the body. So 85% of people, they maximum get a very mild disease, you know, and it's highly possible that some of us maybe even have been infected before we did. And then after that, you develop some sort of immunity to this virus, which is a great thing, actually. That's what we want to happen. Unfortunately, about 5% of the patients who are infected with coronavirus, they have underlying conditions, they have a lot of other medical problems. And because of that, they develop a very severe symptoms and they have a very high mortality. Let me see whether I can add this one here to the chat box. Here, apologize. So if we are unfortunately one of those, if any of us get that, probably most of people that I know here on this, that we are otherwise healthy. We don't have that much of a medical problem, and we are going to be fine. But for people who have pre-existing condition or people who have under basically extreme age, very elderly, and people who have weaker immune system, the chance of infection is so much higher, and those are the population that are usually see mortality. As you know, a lot of public figures disclose their personal information. Tom Hanks had it. He got infected. After a few weeks, he was completely back to normal. Boris Johnson seems like to be had the most complex one among all of the leaders and the public figures. I think Justin Trudeau's wife was also had coronavirus. A lot of like our public figures had it, and some of those who had some pre-existing condition, they died for it. Because of the unknown, because of the transmission that is essentially airborne, which is a very tiny particle of virus that it stays up in the air, it doesn't come down like a dust and particles of the tuberculosis, then it's much more contagious. And especially in the areas that life is much more congested, like New York City or London or Italy, the ventilation systems are older, the people are much more interactive, and the spaces are much smaller. We see much faster, widespread, basically spread of the disease. In US, I think we have been blessed in general. I think nowadays there are a lot of information, partially, but not a very accurate clinical interpretations, and it's basically now everywhere. Currently, I'm working in Corpus Christi. We definitely have I have personally had a lot of those patients. Some of them are doing well and some of them are not doing very well. And it's very interesting that those who are not doing very well are very compatible with the demographics that I explained, that people have pre-existing condition, people have essentially a lot of other medical problems, that any sort of infection would be very dangerous for them. In terms of our area, and specifically Clear Lake and Webster area, I think among all of the big hospitals that they have very strong presence over there. I think between HCA system and UTMB system, I can't specifically talk about the hospital system, but I haven't heard of any complexity or any major issues. So I think the resources are there, but obviously to be on the safe side, the hospitals have stopped doing elective surgeries. And I don't think that that basically was a part of the national movements to limit the social interactions and encouraging people to stay home and stay away from each other to limit the transmission of the disease. And the contagious disease like this, what you guys are hearing a lot about, the flattening the curve, is when I take the disease and I go and meet like 20 other people, it's like a domino effect, and essentially I can spread it to 20 people. So infectious control experts, they try to essentially to break the cycle, and that's why they encourage the social distancing. This has been successful in some communities. Although people might criticize it, but I think in US we are doing the best possible. I think it's a social distancing as it comes with the name. It's social. It's like it's a very multidimensional decision depending on the culture of the community, the needs of the society. I think this has been very difficult for most of us in US. We love to be a part of our community. We love to be active. We love to go to our work. But whatever we do it with a lot of involvement of the other people in our community. That's what we stand for. So I think that's a change, that's a transition that we are trying to all learn from. I think from the hospital resources standpoint, as you heard it on the news, there are some discussions about having some sort of an open space hospital in Houston because of the welcoming nature of the Greater Houston area and having people from all over the world. I think we are, if not the most, but one of the most diverse communities in the Greater Houston area. We are seeing a very rapid increase in the number of the cases that are positive with coronavirus. Naturally, we are seeing higher number of mortality because of the virus. But I have to reassure you guys that overall, I feel honored and I feel very blessed to be living in the United States, because at the moment I think I can share this link with you guys. It is Google, if you can Google just this COVID-19 mortality, you can see the total number of the total number of the cases. I just shared that in the chat room. If you can press on that link, you will see as we speak, there has been 22,858, unfortunately, deaths in the country out of 564,398 confirmed cases. So doing a simple math, this is giving us a mortality rate of 4%. And if you deduct the total number of the deaths that we had in the United States from the worldwide and total number of the confirmed cases from the confirmed worldwide cases, you see that the mortality rate in the world is about 7.1%. So I think with a lot of the work that has been done, we have been able to take care of the COVID-19 patients very fast, very soon, and we have been able to manage it to some extent. But like any other challenge and tragic event, I think it has challenged our healthcare system. It has challenged our country and different part of our community. Personally, my biggest concern is going to be how we are going to recover from the economic impact of it. I think there is a huge concern about the supply chain, especially when it comes to food and essential needs of us, all of our people in the community. I think this is going to be a lot of impact on the different part of the community. But back to our healthcare problems, with basically, as we getting closer to the summer, we can see that the spread of the disease is much slower now. In some part of our country, I think we are now almost on the peak in Texas. In some of the Midwest, it's going to be later in April, based on the data that CDC and most of our national organizations are declaring. There are a lot of talks about the vaccine, hydroxychloroquine, azithromycin, and different sort of treatments for it. At the moment, none of the basically medical communities have been able to confirm any of those. And the reason for that is for national communities and committees, I sit at a couple of those and work with a lot of researchers in the nation. They have to see a lot of information to be able to confirm a medication for some disease. And the reason for that is like all of the medication, they come with a lot of side effects, starting from the simple Tylenol that we take, both azithromycin and hydroxychloroquine, they impact our heart rhythm to the point that it can cause prolonged pauses and it can induce cardiac arrhythmias. So I personally use them with a lot of caution, but that's the only thing that essentially probably one of the safest drugs out there. There is I think Houston Methodist has started to do the plasma transfusion. I have personally done it in 2 patients. But it's a new process that essentially goes back to the basics of us as human beings trying to treat a patient. We say, well, this person had coronavirus, they got better, therefore their plasma probably is going to have the immunoglobulins against the coronavirus. So I'm going to give that one to the second patient who is not doing very well. So very anecdotal, very soft data, what we call it, and none of them have been in the randomized clinical trials, which is our kind of ideal setting of proposing and recommending a medication for this disease. The use of a lot of other antivirus medications are being now again studied. Again, none of them are confirmed. When I personally receive a patient in the ICU with coronavirus, that's usually they're usually in a very bad condition and they are very sick. So my job is essentially to do the breathing machine, ventilators, and those sort of things. I know there has been a lot of concerns about the lack of resources, and I haven't heard anything from any of the institutions that I am working at in terms of lack of resources for ventilators. And if I want to explain to you why the ventilators are pretty much a big deal now, is because when we put the breathing tube in someone, we kind of a very easy source for virus to come out. And this aerosolized particle, when it goes to the ventilator machine, the concern is like how the machine is going to be kept clean, right? So we have a sort of filter, which is sort of very tiny, about 2-inch by 2-inch kind of a filter that we put on the circuit, that essentially that can absorb all of the particles, viral particles. But other than that, there hasn't been that much of a shortage in ventilator in Texas, to the best of my knowledge. The last thing is the PPEs, or personal protective equipments, that has been a worldwide shortage of them, and people have become creative on how to wear different masks. A lot of times, I personally use one of those N95 masks that is out there. I mean, they're not very available on Amazon's. They're not available in a lot of other places that we usually used to take them, but they are very helpful in terms of preventing the particles. The problem with the N95 is it has to be tested and fitted on someone's face. So if someone cannot use them, then there's like a paper which essentially completely covers the head and neck and upper part of the body. In general, I think that will be one of the issues that we have to basically see how we can provide the resources for everyone. In the hospitals, so far it has been good. And again, for my part of the work is we are the one who essentially have to deal with this on the front line. So between emergency department and the critical care, usually we are the priority. I personally try to take some of the masks that I previously purchased. That way, if we can even save one more N95 mask, I feel more comfortable that I can give that one to my respiratory therapist who has to go to the room every 4 hours and give the patient their inhaler and nebulizers. So that's actually one of the source of concerns, one of the source of anxiety among our healthcare workers. We have had nursing and physicians who have been tested positive and they are in quarantine. That also basically puts an extra load on other people who either haven't been tested or have not been basically positive. In the hospitals, there's a very strict policy of assessing everyone who enters the hospital, including employees, including myself. Every day, every morning, my temperature and afternoon when I leave the hospital is tested. So to make sure that basically I'm not an additional risk for patients who come to the hospital for some emergency and do not have the virus. I think with that kind of introduction, I wanted to leave the forum open for discussions and any questions. The first question that I saw here is how many cases in Clear Lake? And Dr. Walker, I wish I could give you a more accurate answer, but I don't know actually. Let me share this chart with you here. And where the testing is being done, most of the primary care physicians, they have been provided by a resource from the Harris County Medical Society, how to essentially send their patients who are concerned to get tested. And when you get tested, there's a phone number and they screen you based on the symptoms. And if you don't have symptoms, they're not going to do it on you. And because of the scarcity of the resources for testing kits, I think the officials have been very regimented who they are going to do the testing on. And I'm going to share and disclose a personal information with you. My grandfather, who is 93, has a lot of medical problems, including heart failure. About 10 days ago, he had these severe symptoms. I think I received a phone call when I was talking to Mike about something else, and I told him that I have to go. My grandfather has some problem. So we got him to the hospital. His oxygen level was low, so I was almost certain that he probably has coronavirus. So he was tested and he was negative. But meanwhile, when we were waiting for him to be tested, obviously both my parents and my grandma, who are in their 70s, and my grandma in 80s, they were concerned. So we have to call the number that the primary care physician gave us. I wasn't able to get them for testing because none of them had the symptoms that meet the trigger for testing. I see the question about feedback on the potential availability of testing kit or material. I think for patients who meet the criteria, I think officials did a great job to the health officials of each county and each state did a great job in kind of a screening and make sure that they're prioritizing sending testing on people who have more higher risk of getting severe disease. It is possible that the testing is going to become available and for the public. I'm pretty sure at some point it's going to be out there. One thing that is about the testing that we need to be cautious about, there are two different sets of testing. The test that looks for a trace of the virus itself, usually that's a PCR test. That's a test that they analyze it like in the blood. And there is a test that looks for the immunoglobulin. So if anything comes back, we all would like to have a positive immunoglobulin that shows that our body has built up a defense system against it. And the PCR looks at the actual virus, which is essentially detects whether or not the infection is currently in our body. Let's say if any of us are among those 85% lucky people who end up getting infected with the virus and building immunity 6 months from now, if someone tests us, 2 weeks from now, if someone tests us, then we are going to have high level of the IgG or one of the immunoglobulins against the virus. So I think, I don't know of any sort of commercially available test is in the market. But I'm pretty sure at some point it's going to come out. And if you don't have any symptoms, I don't think that there is any major reason for being concerned about. Thank you, Melinda, for this information. Actually, this is pretty cool. I like the and Dr. Walker, about the governor's opinion about reopening the economy. I think I'm not a politician, so I have my own personal opinion, but I think following the overall guidelines by the healthcare community, we need to do the basics. I personally am slightly softer in terms of how much we have to limit our economy and our day-to-day operation because of this virus. I think I have a lot of trust in in our professional environments. I think a lot of our people are citizens. They're very responsible people. They go and they try to keep wash their hands, keep everything clean, and be distant from each other. I think obligatory sort of isolation is going to be, and it's going to be probably challenging for our community. So. Adrian, I am going to. Oh well, Adrian, congratulations! That's very exciting. In fact, my wife is pregnant and we are expecting. So I sometimes joke with her. I say, "Honey, I am your biggest risk factor." So she didn't stop working. But when I get home, I take out all of my clothes and scrubs and put it in the plastic bag. She's an occupational therapist, and she has stopped going to the hospital because she was taking care of a lot of transplant patients. Unfortunately, her colleague tested positive, who is also pregnant, and her colleague had to continue to work because her husband was having some challenges at work. He was basically laid off and she was the only source of income. But gladly, she's fine. She doesn't have any symptoms, and there hasn't been any negative impact on her pregnancy to the best of our knowledge. But we definitely, both Christina and I, are keeping them in our prayers because that's really stressful. But I do think that as you said, you need to really make sure that they are protected from public as much as possible. And if you're in a profession that you're not really out there in the community that much, I think it should be safe for you to go and see her, and hopefully by then things are going to get better. You can also like talk to your primary care physician, and you can say that, you know, I'm going to meet my daughter. Your daughter is going to be at higher risk compared to her newborn, because pregnancy is a situation that decreases the immunity of our body. Going to the next question with Walter Waldhoff.
I don't know. I don't want to argue with her.
Well,
I just wanted to know for myself, but I don't know if I believe it.
Well, you know, yeah. Walter,
John
I don't think that there
$20
is
to go buy food.
Yes. I don't think that there is any other thing that, Walter, that we can offer
my screen protector
other than
comes
the social
Wednesday.
distancing and
That's okay. We used to have this.
with the exception of like the washing our hand and doing the basics, making sure that we are keeping ourselves away from person who is sick or anyone. I think Stan has a question about what is so unique about the anti-malaria medication that makes it useful against the coronavirus. I think, Stan, this is about the attachment of the viral particle to the cell. And that's how they think that the hydroxychloroquine can prevent the virus from efficacy. But other than that, there's nothing very special about it. In fact, it's one of the cheapest drugs. It has been around forever. One of the common concerns that I personally have about the anti-malaria medications is cardiac dysrhythmia and its interaction with the other medications. It suppresses the effect of the other medications or increases the metabolism of other medications very much. And let's make sure that we didn't have any questions. How are you doing in terms of the number of the beds available in the hospital? In all of the hospitals that I am working, Mr. Smith, I haven't personally had any challenge, but I think some of our public hospitals had some difficulties, and obviously this disease has been shown that people with lower socioeconomic status, people who have more limited access to health, they have a worse course of the disease. This is a tricky statement because at the end of the day, we know that those kind of people usually they present the hospitals and the healthcare community much later during the course of the disease. So a lot of the damage is already done. But yes, I agree with Dr. Walker's statement that she wrote down here, news research showing low dose of malaria medication is safer. Yeah, probably lower dose safer, but again, I use it with a lot of caution. Any other questions?
Okay. Thank you, Dr. Roozbeh. We appreciate the time you spent with us today. It was very informative.